Watching Sabrang TV. Being in business since 2010, KPG Taxation are experts in a range of taxation services, including individual tax returns, GST, payroll, bookkeeping, small business services, and of course, company partnership and trust tax matters. Working with KPG Taxation couldn't be any easier than simply downloading their mobile app, KPG Taxation. So if it's a friendly professional service you're after with a name you can trust, contact KPG Taxation today on 1300 KPG Tax.
KPG Taxation.
Welcome everyone, my name is Dr. Raj Khilan and here we are with another episode of Health Awareness Campaign which we started a few weeks ago, and in this episode we are bringing doctors from our South Asian community to create awareness about health related issues in our community, particularly South Asian community or Indian subcontinent. And today we are very lucky to have with us Dr. Gopal Kataria. Dr. Gopal Kataria is a director and principal orthodontics in Angle House Orthadontics Clinic, Baldwin. He is a leading practitioner, orthodontist practitioner in Baldwin. He has recently been awarded as a lifetime achievement award He has been awarded as a lifetime achievement award for Invisalign procedure as the maximum number of provider of this procedure in New Zealand and Australia. Dr. Kataria, welcome to our show.
Thank you, Raj.
Thank you. And first of all, I would like to congratulate you for your achievement. What achievement you had in that young age to have a lifetime achievement. Tell us a little bit about what that award was.
Dr. Khilan, this award is actually to be given to someone who has done one of the largest Invisalign providers in Australia and New Zealand, and I was awarded this in the recent conference in Hobart. Basically, it kind of acknowledges my experience in the Invisalign technology, because that's a very emerging technology and a new way of correcting the crowding of the teeth.
Thank you. I must congratulate you in that way.
Very much.
Okay, Dr. Kataria, tell us a little bit, as a layman, we would like to know about my concept, and I'm sure majority of Indian subcontinent and South Asian community, subcontinent people, they have the dentist is the one specialty and they deal with everything in relations to teeth. So what is orthodontics and what is the role of orthodontics? Can you give us a little bit of an idea about that?
Dr. Khilan, orthodontics is a specialty of dentistry which deals with correcting the crowding of the teeth, straightening of the teeth, and also it involves if there is a jaw growth is small or big, we can actually improve that at the right age by different methods.
Okay, yeah. So in that case, we can say orthodontics is the branch which can bring smile on many faces.
Yes, it mainly deals with improving the smile, and improving the smile actually has got a lot of health benefits and obviously some psychological benefits as well.
That's very interesting to know, Dr. Kataria. So tell us a little bit about psychological benefit. As we know, like when the teeth are overlapped or overcrowded, and particularly in the young growing teenage girls, and they take all role model from Hollywood, Bollywood actors, and have those who are having a very good, beautiful smile, and they want to take the same smile. So if they have not having a good smile, and it can have an impact on their, the self-esteem, the confidence. So how this will, your branch, orthodontics, or bringing the right smile will help?
Well, that's very true, Dr. Khilan, because I see a lot of young teenage girls and children as well with crowded teeth, or the buck teeth we call them, and they're very conscious of their appearance, and they're very conscious because of the appearance. They're very, their self-confidence is down, and it helps them. It avoids them to performing to the best of their, ability. And also sometimes we see, especially in our subcontinent, where the Indian parents are more stressed about now we have to get the girls married and the teeth are not looking good. So obviously it affects both teenagers as well as the parents as well. And so if we use orthodontic treatment by either braces or Invisalign, and we improve the smiles of these children, obviously it helps in their personality, it helps in their overall performance in society, among their peers as well. And also for the parents it's a much relief, then yes, they can get better matches if the girls have good, or the boys even have good, good looking smile or teeth. Obviously it acts as one of the factors in getting a good suitable match for them as well. So yes, orthodontics can definitely help to improve the smile and the personality as well.
Thank you, Dr. Kataria. I think we always heard that beauty is within, but appearance also does make a difference. How you look like, how beautiful your smile is. So definitely having a healthy, beautiful smile adds to your personality, to your confidence and self-esteem, and particularly in a young growing age. Dr. Kataria, so correct me if I'm wrong. So far we came to know that this is dealing with the cosmetic aspect, bringing a smile, making you beautiful, or bringing more healthy smile. So that this deal with, or straightening of the teeth deal, bringing only the healthy smile or cosmetic effect, or this we look beyond the cosmetic part in this area?
Dr. Killen, obviously, as you said, in majority of the population, orthodontics is seen as a vanity, or we are just creating a good smile or good appearance. But actually orthodontics goes beyond that, because it's not just the straight teeth we are getting. We need to look at the reason why we want the straight teeth. Because if you have got straight teeth, it's much easier to clean them. That will definitely target two things. Number one, if your teeth are clean, it means you won't have cavities, which means no toothache, no emergency visits to the dentist or for having tooth extraction. Second major benefit from having straight teeth would be that you can clean your gums also. Now, if your teeth are crowded and the gums you can't clean because the teeth are crowded, then it can lead to a lot of bleeding gums, and a lot of bleeding gums are associated with many medical problems these days. It's very related to the heart diseases as well. So actually, if you could target all those things just by having straight teeth and no gum disease and no cavities, obviously it goes beyond that. And the other thing which we have already discussed is the psychological benefits and the self-esteem in a person. So that's why I think orthodontic goes beyond just the straight teeth. It has got a lot of functional and health benefits as well.
Thank you, Dr. Kataria. I think it's really interesting to know that orthodontics does not only mean a beautiful smile, it goes beyond that beautiful smile. It has got a number of health benefits, and very rightly mentioned one of the benefit was heart disease. And as an audience, you might be surprised to know how does it improve the heart conditions, how it help in reducing the chances of heart issues. That definitely is well known that sometimes the gum infection, the teeth infection can cause that type of changes in our body, that infection can settle in the heart too. And that can be well prevented if we can avoid the tooth cavity, as Dr. Kataria rightly mentioned, or other way we can say when you go to your dentist for tooth filling, that's the tooth cavity is being filled at that time, so that can be avoided. And then definitely overcrowding means when the teeth are overlapping over each other, or when you see the teeth are in front of each other, or there is a double teeth there, that can also be corrected, because sometimes the food particle can get entrapped in this overlap teeth, and that can be source of infection or creating a cavity in the teeth. That's very interesting to know, Dr. Kataria. Very good information. And just going beyond the the cosmetic part, and you mentioned so many benefits having a straightening of teeth in that right time if it is done. Sometimes, like particularly I'm a pediatrician and I do, so many children come with snoring, and when they snore, they snore with their mouth open, or many kids even, they keep their mouth open even when they are walking around, keeping the jaw open all the time. Does straightening of the teeth or have any improvement with this type of things, or
Dr. Killen, yeah,
any relations with this?
Yeah, that's a very good point you have raised today, because most of the community that think that, as you were saying, that it is just straightening of the teeth, but actually when we see a young child snoring, it has a lot of components which could be fixed by orthodontic treatment as well. The reason the child is snoring is because it could be some adenoid or there could be some other medical issues. But what we see in a snoring child, that the lower jaw is coming down and the tongue with that lower jaw is also coming down. When the tongue comes down, the roof of the mouth, which was actually supposed to be shaped by that tongue, becomes narrow. And when that roof becomes narrow, the floor of the nose becomes narrow and the breathing capacity becomes less. So it's kind of a continuous cycle. And when the upper jaw becomes narrow, the teeth, they do stick out. So as an orthodontist, our role is mainly to expand the upper jaw so that we can actually get that shape back, we can get the floor of the nose widen as well, and that will affect their breathing capacity as well. Obviously, we should not be forgetting that there could be some medical reason that also needs to be fixed. So there are various pieces of the same puzzle. So one piece of the puzzle could be corrected by orthodontic treatment by expanding the jaw, and that improves the snoring to a very large extent. Along with, obviously, they have to see the medical doctor to get their adenoids removed if they have got large adenoids.
Thank you, Dr. Kataria. Very, very right information. I think Dr. Kataria used the right term, pieces of the puzzle. The puzzle is snoring, and the pieces of the puzzle might be many causes behind that. Snoring, as being a pediatrician, I can say, if it's a persistent, continuous snoring, loud snoring each and every night, some kids they snore intermittently or when they have a cold, that's okay. But if they snore continuously, snoring at any age, whether you're 4 years, 3 years, 10 years, 30 years, or 50 or 70-year-old, is not normal. It needs to be taken seriously. Snoring, of course, commonly can happen because of underlying adenoid, but if it persists for a long time, it can have impact on the jaw growth, as Dr. Kataria has mentioned, and then lower jaw capacity is become small, the mouth capacity becomes small, and then it becomes a major procedure needs to be done later on, which can be sorted out in early age by simple procedure. So if your child snore, or if as a adult you snore, see your GP. If as a child, see your pediatrician to get the help early, and a pediatrician can guide you to the right pathway, whether you need to see a dentist or you need to see an ENT specialist.
That's very true, Dr. Raj.
Thank you very much. And I think we will take a short break here. Please don't go anywhere. We will be back soon within a short while. Thank you.
I've had this problem.
Big problem.
I really needed
a good migration consultant.
And I kept searching.
And searching.
There are so many choices.
It's really hard to find one that has all the things on my list.
But I finally did it.
Yes! Thank you!
If you are looking for one as well,
look no further.
Here's a really good one.
Just use mine.
Use mine.
I'm very satisfied.
Definitely recommend. Problem gone.
Thank you.
Now don't forget to call Vision Overseas on 03 9939 9036 or simply visit www.facebook.com/visionoverseas for your next visa.
Welcome to Lakshya IELTS and PTE coaching. Are you an international student looking to improve your English skills? Are you seeking registration for teaching or nursing? Maybe you're looking for admission into an Australian university or college. Perhaps you need an IELTS or PTE result for skilled migration, RSMS, 457 or other visa. Look no further than Lakshya IELTS and PTE coaching, with office locations in Reservoir and Melbourne CBD. Call 0404 527 518 for a free trial class.
Welcome to Savi's Top Choice Hair Salon, Beauty and Boutique. Our staff are qualified and experienced in whole range of hair and beauty services, including skin tightening, laser hair removal, skin rejuvenation and waxing. Our beauty services include eyebrow threading, makeup and henna, and facials. We also specialize in haircuts for men, ladies and children, as well as coloring and foils. If you're looking for jewelry or clothing, we also carry a range of traditional and formal wear for men, ladies and children. Visit us at 729 High Street, Epping, or call 038401 3131.
What's up guys, it's your boy Bach and you're watching Sabrang channel.
Welcome back, and we are watching here health awareness campaign, and we are talking today about orthodontics treatment, particularly to bringing your teeth aligned or straightening your teeth and bringing a beautiful smile on your face. And we are lucky today, we have with us Dr. Gopal Kataria. So we'll continue our discussions again further. So Dr. Gopal Kataria, welcome back after the break.
Thanks for
And look, we were talking about bringing the smile, and I'm just wondering, in that way, what would be the right age the patient should contact you or parent should contact you? Is it a teenage, 5 years, 7 years of age, or 30 years, 40 years? Is it too late? What would be the right age or right time for people should contact a orthodontics to align the teeth?
I think that's the best question, I will say, Dr. Raj, because we as orthodontists really want this awareness in the public that what's the right age to see an orthodontist. So technically speaking, most of the world orthodontic societies, they would like the children to be screened at the age of 7. So when I say at the age of 7, it does not mean that we are doing the orthodontic treatment at the age of 7. We want to do some screening x-rays at that age. Those x-rays are very simple and they can show us whether this child has got extra teeth or missing teeth in the bone, because the teeth are still developing at that age. So it's really important to find out the number of teeth, what we are going to deal with in future, and then we have a blueprint and we can work on it. So if a child, for example, has got extra teeth and we find it in the x-ray, rather than waiting for those teeth to come out in the mouth, we would plan them to be removed sooner, because those teeth are going to cause more problems like cysts or tumors sometimes. If a child has got missing teeth, which is very common as well, then we can actually plan that in coming years, how are we going to deal with those missing teeth, because if the teeth are missing, there will be gaps. So how we are going to deal with those? So we actually can plan at an early age. Other advantage of screening at this age is we can see in which direction the jaw is going to grow, whether it will be small or a big jaw, and then again we can plan at what age we should be addressing it. So by screening a child between the age of 7 and 10, we actually have a lot of information to work on in future, and we can decide whether we should treat it now or whether we should wait for some more years. Now coming back to the question of whether a person is 30 or 40 years of age, yes, we can definitely treat any age, because in my practice, the oldest I have treated is 79 years of age and the youngest I have treated is 4 years of age. But they all have different set of problems, and the way to treat them changes with their age. If a child is young, we can work more with his bones, because the bones are more soft and pliable, and when we do the straightening of the teeth, the bone actually sets around that teeth and it stays like that for the rest of the life. Whereas if a person is old or mature, the bone has already set around those crooked teeth, and then we have to either take out some teeth, or we have very limited capacity to work with the bone growth or jaw growth, what we say. And that's why it's really important. If I have to choose either of these, I would like to be screened at a young age rather than coming at an old age. But yes, it can be treated at any age. It's just the way of treatment can change with the age.
Thank you, Dr. Kataria. So you all saw Dr. Kataria said no age. There is no age bar, no age. It's never too late. You can bring a beautiful smile on your face at any age. Yes, young age has its own advantages. If, as Dr. Kataria said, ideal age to have an initial assessment at 7 years of age, so where orthodontics can go through more in detail and make a future plan when is the right age, what treatment needs to be given for that particular child to bring the beautiful smile on your child's face. If your child has crossed that age and now he or any member of the family in 30s or 40s, it's still not too late to bring that smile on your face, though the treatment might be a little bit different and it might take a little bit longer time. Is it right, Dr.
Yes, Dr. Kiran, obviously.
Other thing I would like to know, like sometime when we're talking about the age point of view, the treatment, would it be different if child comes to you at the age of 10 or 12, or at the other way comes at around 30 or 40 years? Would you use the same treatment modality? Would you like to say?
Dr. Kiran, if a child is young and he has got crowded teeth, we can actually easily expand his jaws to create more room, and we can do the treatment without taking out any teeth. If a child is young and his jaws are small, we can always change the size and shape of the jaws, and by doing that we can actually avoid the jaw surgeries in future. But if someone is who is in 30 or 40 and the bone is now different bone structure at the age of 30 and 40, if someone has a really small bone, then obviously we have nothing to, we can't do much, but we have to do the extraction of the teeth. But if someone has got a really big bone, we can always align those crooked teeth at that age. The modality could vary. Either we could use braces or we could use Invisalign.
Yeah, I think here I would like to know, these two modalities you use, the braces and Invisalign. And particularly, I don't have much knowledge about the braces and the Invisalign. But for braces, I've seen many adults are wearing and children are wearing. But when they speak, it can affect how you communicate. Like some words might not be clear, and sometimes food can stuck in the braces, which some people can feel it really, not very good, an unsightly appearance. And they also feel a little bit conscious that the braces are being in front of the teeth all the time. And probably maybe it might put off some people, those who don't want to because of their profession or something, to have these braces all the time. And so do we have anything different way where these braces are not put on the teeth and still they can have a beautiful smile?
Yes, Dr. Killen, because I agree with you, the braces, they come with their own challenge of number one, their appearance, number two, when they're eating food and the food gets stuck, and for adults it could be socially very embarrassing. And you're very right, there are lots of adults who have this wish to have straight teeth, but the idea of the braces, it just puts them off. So for those people who are really wanting to have straight teeth but they do not want braces, Invisalign is a new, I would say relatively new technology, which consists of very thin, kind of invisible, very light mouth guard sort of thing, which sits on the teeth, so people actually can't see it. That's why it's called Invisalign, because it's kind of invisible. And the other advantage of that is speech is very clear. You don't have to deal with the braces. Sometimes they cause ulceration and pain as well, so that doesn't cause that. And also because you can take it out, so technically you can eat whatever you want. Whereas with braces, you have to be very careful with what you are eating because the braces can break if you eat anything hard or if you eat anything which is going to be stuck between your teeth. Whereas with Invisalign, you just take it out and eat whatever you like, and then you can brush your teeth very nicely because it's much easier to clean your teeth in their natural form rather than having the braces on them. And also it enhances your social appearance and your self-confidence that your teeth are becoming straighter without people noticing it, and you don't have to be feeling very embarrassed that I'm doing something obvious on my teeth. So Invisalign could be used in those people, and these days the young children are also becoming very aware of that modality as well. And as I mentioned, my youngest patient at this age is 8 years of age, who is doing really well with Invisalign, and my oldest patient with Invisalign is 76 years of age. So this modality is becoming really popular because of its so many advantages over braces. Given a choice, I wouldn't put braces on my child these days because I can see there are lots of advantages of Invisalign which I find are really the way to go these days.
Thank you, Dr. Kataria. This is really an eye-opening thing that you don't need to have braces all the time on your child's teeth or even as an adult. There are alternatives, and Invisalign, as we heard, is one of the techniques. And Dr. Kataria, as I mentioned in the beginning, he got a Lifetime Achievement Award in this technique, and he is one of the gurus of Invisalign. Dr. Kataria, thank you for giving such a fantastic information. Can you give us a little bit more insight, detail, what that Invisalign is? How does it work? This technique is, just in short, if you tell us a little bit of an idea.
Okay. So Invisalign consists of very thin removable plates. They are called aligners because they are aligning your teeth, and each aligner you have to kind of wear for 2 weeks. Let's say the first aligner is like this, second will be like this, third. So there's a very subtle change in each plate. Each plate is like a mouth guard, but a very thin version of mouth guard that you can't see. So a series of these plates are to be worn over a period of time, and then it moves your teeth very slowly rather than with braces. It moves sometimes faster and you have more pain with braces, where with Invisalign, because the teeth are moving very slowly, so you don't feel too much pain as compared to braces. And also because your teeth are moving slowly, it's very gentle on your gums as well. So there are lots of adults who got gum problems. In those cases also we say, if we put braces on your teeth, you can't clean your teeth properly, and then you end up having more gum problem. Invisalign is actually very gentle to the gums because you can take them out and clean your gums as well. So it consists of these removable plates which you have to wear over a period of time.
And on the top of that, it's Invisalign, it is not visible from outside.
Yes, unless somebody really stares at your teeth.
Yes, I mean unless until very, very close, but otherwise from a distance, as the braces are visible, it's not
visible at all. Yeah.
Fantastic.
I have got actually, to be very honest, I've got few celebrities who have done this, and they were performing on the stage, and they chose this modality because nobody could point out that they were doing something to their
performing on the stage with the Invisalign
on. Yeah, because they can sing, they can do whatever they like.
Fantastic, fantastic. So definitely the era of braces has gone on. In fact, we can say
the day is not far.
Yeah, fantastic. Look, Dr. Kataria, can you tell us a little bit about I'm a pediatrician again, and my skills always enter in there. And very common other problem we see in our practice is thumb sucking. And can you just give us an idea, like, is thumb sucking normal? Like some people take it as thumb sucking as the dummy sucking. What is the age they need to stop? Or if not stop, what could be a long-term effect on the teeth or on the jaw or on the whole of the mouth cavity if child continue to thumb suck at 4 years, 5 years, 6 years of age? And sometimes it become a habit.
Yeah.
What would you like to say?
Dr. Kiran, again, that's a really good question because we see these children all the time, and as you said, sometimes it starts as a dummy sucking and then it's replaced by the thumb sucking. The children do thumb sucking because of various reasons. As a pediatrician, you might be aware that sometimes, or I should say most of the time, there are some subconscious effects going on as well, and that goes into translation into the thumb sucking habit. If the thumb sucking habit continues beyond the age of 4, as an orthodontist must be consulted, because beyond the age of 4, now your adult teeth have already started to form inside the bone. By that age, children have baby teeth, so it's not really doesn't affect much. But beyond the age of 4, when the adult teeth start to form, then what happens is it's starting to change the shape of the jaws, and it also starts to push the upper teeth forward, and it also makes your upper jaw narrow because you're putting too much pressure on the thumb. So as a result, a thumb sucker would typically have a very narrow upper jaw and teeth sticking out forward, and sometimes the lip will go behind the teeth, and that's called the buck teeth as well. And it will again lead to more mouth breathing habit because the children can't close their teeth together, so they will breathe through the nose or breathe through the mouth, and it leads to more mouth breathing habit and snorers. So typically they're called adenoid faces as well when it starts from the thumb sucking. So the thumb sucking should be addressed beyond the age of 4. When it continues, obviously some children, they are now becoming more aware, but they can't stop it, and that's where they need some professional help, either from the orthodontist, and sometimes we ask them to seek the counseling from the pediatrician as well, because they can address some underlying subconscious issues that might be going on as well.
So, what advice would you like to give for, and what can be done if a child who continues to thumb suck at 4 years of age or 5 years of age, and as a orthodontist, what advice you can give to parent and what they should do, and or when they should consult you at 4 years of age, and what generally would you like to do in that sort of a case? It's just a bit of a rough idea for all of us, please.
Look, the short answer for this is putting a plate in a child's mouth, which actually restricts the putting of the thumb in the mouth. But what I find that applies as a kind of the child could take it as a punishment, that I'm doing something wrong and that's why my parents are doing something for me to stop me doing that. So over a period of time, I actually have devised this strategy of counseling with the child. We ask them, we generally discuss with them what could be the repercussions or long-term repercussion of this thumb sucking, that if the teeth are coming out, then eventually they will need a complex orthodontic treatment, and we show them some visuals that could be the effect of the thumb sucking habit, and we ask the parents to maintain a diary of how often they are doing it. And very interestingly, when we ask them to make a diary, the child has to make a diary, and most of the children actually they want to stop it. When they make a diary, majority of the time they become aware of that habit what they are doing, and then it reduces it. And when they can't do it, then they know that they have tried their best, and that's why they are seeking the help from the orthodontist, and we can put a plate there which stops the thumb sucking straight away. But we want to give the child first chance to stop it by itself, rather than taking it as a punishment from the orthodontist that he has put something in my mouth, because that can actually put them off from the dentist or the orthodontist for the rest of their life, because that person did something in my mouth. So we normally want to address the child and take the confidence in the child, and that's how we sometimes address the thumb sucking habit.
That's very interesting. And sometimes, as a pediatrician, I see particularly children from Indian subcontinent and South Asian community, and they use some other sort of a punishment of the child, like you said, putting a plate could be punishment, maybe dipping the thumb in a chili, or wrapping the thumb with certain clothes, with certain things. What do you want to say for these parents? Is it a right way to do? They are doing this punishment. Does it affect it, or it brings a lot of negative impact on a child?
Yeah, personally, I think it's quite traumatic for a child to do all these methods, which we have been talking, especially chilies. And I've seen some people will put a soap on the thumb as well, so the child doesn't do it. But I think rather than just treating the thumb sucking habit, I would like to go behind it, and why the child may be doing it. Because nobody is just born with like this. There has to be some reason, and we explore it further, and we find it most of the time. Sometimes it's the oldest child in the house which feels neglected when a young sibling is born, or sometimes when the child is not performing well in the school, then it starts as well, or sometimes it could be just a fear of something and the child is not able to express, and then he goes into thumb sucking habit. And very interestingly, some children, they will have a secondary habit with thumb sucking. For example, the girls will be twirling their hair. So sometimes if you even just snip that knot of the hair without letting the child know, you will find that this could be curved as well. But I think most importantly, we need to go behind it rather than making the child feel that it's a punishment for you if you don't stop it, because then it becomes an attention-seeking thing for the child as well, and actually you are now making it more prominent in that child. So I think rather than making it really big thing for a child, try to go behind it and why this child may be doing the thumb sucking habit. So I'm more on that.
Thank you, Dr. Kataria. So, friends, you've seen thumb sucking is a common thing to see in children. Thumb sucking is a subconscious way of childs might be having some underlying psychological or behavioral issues. It might come as a package rather than as a single thumb sucking habit, as Dr. Kataria mentioned. So important thing is to look beyond the thumb sucking and see if there is any other psychological impact child is having, stress in the family, other behavioral issues child is having. So it might need to be assessed in detail to find out thumb sucking. Of course, thumb sucking should be stopped as early as possible, but punishing the child is not a solution. Seeing a orthodontics or pediatrician, if it continues beyond 4 years of age, is important because it can have a long-term impact on child's teeth, and as Dr. Kataria mentioned, that it can deform the teeth, particularly the upper jaw teeth, and it can bring the upper jaw teeth out, and it can lead to overbite or jumbling of the teeth over each other, and might later on can have a cosmetic impact, there's no doubt about that, but may need a
complex
orthodontics treatment, and child might develop snoring too. That's fantastic and very insightful information you have given, Dr. Kataria. Can you just tell us a little bit about, we touched base slightly about extraction of the teeth. I mean, I would say most of the time, as a layman, general public, we have a concept in our mind that if you want to align your teeth, particularly if teeth are overlapping to each other or in front of each other, one of the tooth might need to be taken out to give a room for the another tooth. So, is that true? And when or if it can be avoided? Because that could be really a scary and painful experience for the child particularly, and of course for the family to watch your child going through that during procedure and after the procedures too.
Yeah, Dr. Killen, I agree with you that most of the society, connects orthodontic treatment with the extraction of the teeth. That if the teeth are bucky, take the teeth out and push them back. If the teeth are crowded, take the teeth out and improve the crowding. But actually, in my opinion, these extractions could be easily avoided if a child or if a person is seen at a young age, at the right age, and at the right time. So for example, we see, as a parent, we see our children losing their baby teeth. But actually nobody knows that if a child is losing baby teeth, it has to be in a sequence. So one tooth goes before and then adult tooth should be coming out. But what happens most of the time, we see that one baby tooth is gone and the other tooth does not come through. And what happens, the surrounding teeth, they move into that area. So as a result, we are cooking the crowding without even knowing that. So what happens is when all the other teeth come through, there is no space for that adult tooth to come in the mouth. Then in that case, when the child has got all the adult teeth in the mouth, either we have to take out one tooth, which actually could have been easily avoided if when that child has lost that baby tooth, if you see an orthodontist and he can put a space maintainer. So if you could maintain the space for these teeth when the baby teeth are being lost, the extraction in future could be easily avoided. Then comes the buck teeth. Sometimes you see the children have got really bucky teeth. Then again, most of the time the bucky teeth are associated with our...
Sorry to interrupt, Dr. Kataria. can you just give us a little bit of idea what bucky teeth means is?
Well, the buck teeth is, we say, because when the teeth are quite protrusive or quite coming forward, they are called buck teeth, and they can't close their lips, sitting like that.
Ah, okay, so upper tooth, like teeth coming out like this, and
yes.
then the lower one is in, so it's overlapping like this.
Exactly.
So
and
like open bite rather than the end-to-end bite.
Yeah, it's like the teeth are coming out, and your lower lip is sitting behind them, and they can't close their mouth.
So in that way, so instead of coming straight like this, it's coming like
exactly.
Like
so they're coming like this, and most of these are actually associated with the narrow upper jaw, and that narrow upper jaw, as we mentioned earlier, could actually be because of various reasons like a thumb sucking in the past, or a mouth breathing habit, or it could be just a structural way. And if we could have that jaw corrected, the jaw shape corrected at a young age, then these teeth would not be pushed out. So that way also the extraction of the teeth could be avoided. So my take on that is, if you have a child and he's losing the baby teeth, he should be seeing the orthodontist to find out, well, is it the right age for him to lose these tooth, so that we can do either space maintenance or we could do expansion of the jaw to get enough room for those teeth, so that eventually we don't have to remove the teeth. And there are many times when we see the adults with a lot of crowding in their teeth, and it is mainly because the space was not managed when they were losing their baby teeth, and the adult teeth, they just came into wherever they could come. And that's where the extractions in some cases had to be done. But in my opinion, majority of the cases, extractions could be avoided by targeting the expansion of the growth or the jaw growth if it is done properly, or putting the space maintenance.
Thank you. So dear friend, you heard what Dr. Kataria said. The extraction of the teeth is not necessary. It can be avoided if consultation is done early. Later age, there might be need for extraction of the teeth. So it is against the general concept that teeth needs to be taken out to align it, to bring the straightening of the teeth, or to bring a beautiful smile on your face. So that painful procedure can be avoided if you see orthodontics early in age. Dr. Kataria, as we are running out of time now, so I would like to ask you the last question about we talk about the upper teeth and the buckling of the teeth as the term you use, and particularly thumb sucking, the bringing the teeth up. And we also talked about when the child or the adult is sleeping and the snoring happens, and it can also sometimes lead to stopping of the breathing in the night time, sleep apnea. So what is the relation or importance of growth of the jaw in relations to the whole teeth issues? Because we do see some of the adults, like you tell us more in detail, that the jaw is not well grown at the level of the face, it's more behind the level of the face. Mm-hmm. So what could be or maybe what we call is a small jaw. So what could be the impact of that, having a small jaw, and if it is behind, not at the level, and instead of here, it's here. Yeah. So what could be the issues patient can have, and what can be done, and when they should see orthodontics or other doctor to make the things better?
So Dr. Kilan, there could be two issues with the jaw growth. One, it could be either a small jaw, or the other it could be a big jaw. And sometimes it's a combination of upper jaw is big and the lower jaw is small, or the other way around, the lower jaw small, upper jaw is big. So this jaw size issue is related to the growth of the jaws. When the child is growing, as an orthodontist, we can definitely affect the position of the jaws, and to some extent we can actually guide the jaw in the right direction. If it is not done, and as one part of your question was, what will have impact on the person? So obviously, if the lower jaw is sitting behind and not in level with the upper jaw, then it affects your biting, your chewing efficiency. It also affects your breathing efficiency, and it also can lead to a lot of snoring because your jaw is sitting back, which is pressing on your airway.
There is not much room in the in the mouth for the tongue to be accommodated.
Yes, and for that they have to open their mouth and then they develop into snoring. So all these things can happen, and that's why it's really important to affect the growth of the jaw by orthodontic treatment at a young age when they are growing. When we are growing, we have got 3 times we have got growth spurts. If the orthodontist is seeing a child around the growth spurt, it's much easy to have that growth spurt to work in their benefit, because once we have that growth happening, we can improve the position of the jaw, and once the jaw comes in a good position, it then continues to grow in a better position throughout the life. Whereas if you have missed that growth spurt and now you are adult, then only option is the jaw surgery, which could be quite painful, quite expensive, and it has its own side effects as well. So jaw surgeries in adult to affect to treat the snoring are very common, and sometimes they are necessary. But my take on that is, well, if I have seen that child when he was if I have seen that adult as a child, that person would not need jaw surgery in today's date. So that's why it's really important to improve the jaw growth. And in orthodontics, we got lots of plates which can be used to bring the lower jaw forward, or sometimes the upper jaw could be stopped to grow further, and the lower jaw could be actually brought back as well. So we can use those modalities, but the time has to be right. And again, my message is, the earlier you see the orthodontist, the better it is, because you can get the good results at the right age, and not only the good results, they will remain stable for the rest of your life. Whereas in the old age, we have to do most of the time either jaw surgeries, or sometimes we have to still do extraction, which is very unfortunate in my opinion.
Thank you, Dr. Kataria. So, jaw operations, jaw surgery can be avoided if, again, the message is that consultation with orthodontics done early age. When it comes to the early age means in a childhood, because the growth of the jaw is very slow and it is not easily detected by the family member. So better to have a consultation early so that the major surgery can be avoided later. But again, I would say the message is, it's never too late. Even if you think it has been missed in early stage, still a lot of things can be done. See your doctor, see your orthodontics early. And with the same message, we will, as we are running out of the time, we'll end our program over here. Again, I would like to say, please don't forget to give us your feedback. How things going on in this program? What other topic would you like us to discuss? We will be bringing our team of doctors each and every week to directly connect it with you, to deal with the common health issues which in our community is very common. We will be also dealing with certain social taboos, social stigma associated with medical issues, medical diagnosis. So please stay with us, be connected, keep watching. And now, bye from Raj Khilan and Sabran TV. Thank you very much. And thank you, Dr. Kataria, for giving a valuable time to us.
My pleasure. My pleasure.
Thank you very much. Thank you.